to Freedom from Fire. Here you hear all types of good information so that you can keep yourself safe. And one of the key things that we do is we share that information through bringing to you many leaders in the community, people who do a lot of work in the community, making sure that people are safe in their environments. And that's one of the key pieces that we have. This week, we're going to have a very great show for you. We have some excellent community leaders, and we're going to be talking about a very important subject. But right now, one of the key things that's the buzz in the city right now is that fire deaths were at their lowest in recorded history, 25 fire fatalities. Now, while the Philadelphia Fire Department, we feel good about that. That means that we're educating, that people are starting to get it, and that's important. But it's not enough for us. We believe that we should have 0 fire deaths, and that's our goal. We don't want anyone to die from a fire. We don't want anyone to be injured or maimed in a fire. So we want to make sure that you get all of the information that you can so that you can keep yourself safe and keep your family safe in your environments. One of the key things that we've been able to do over a long period of time is make sure that people understand our stool, our safety stool. And our safety stool is, one, smoke alarms, making sure that you maintain those smoke alarms, working smoke alarms, one on each level. And you want to make sure that you test them weekly. And also, you now have to have, in the city of Philadelphia, 10-year lithium battery powered smoke alarms, and they must be sealed so that you can't get to that battery. And we make sure that we install those in our communities now. Our firefighters, our men and our women, they go out, they knock on the doors, and they make sure that you have smoke alarms in your home if you can't afford them. But we want our citizens to understand and to know that you can go to any of those stores where you have home improvement, any of your hardware stores, and you can get your smoke alarms. You are able to pick those up, one on every level, making sure that you test them and make sure that everyone knows what to do in case of fire. If you hear that smoke alarm go off, you should be doing some very important things like a home escape plan. Now, that home escape plan says that you know exactly what to do when that smoke alarm goes off. There's 2 ways out of each room in your house, and you make sure that everyone that lives in your home, everyone that comes to your home, visitors, etc., understand exactly what to do when that alarm goes off. That's the second leg of the stool. The third leg of the stool, of course, is the home escape planning, where you sit down, you make sure that everybody knows what to do when that alarm goes off. Everybody knows what each room is like, how to get out. All of those things are very important. And the third leg of the stool is the home fire safety checklist. That home fire safety checklist gives you about 30 different items in 6 different areas where you can do the self-assessment. You can check how you're doing in your home, in your environment, in your apartment, in your condominium. It doesn't matter what you're doing in your home to stay safe. So you do the self-assessment, you check yourself, make sure that you go down that checklist. That checklist is yes or no. You're either safe or you have a hazard in your home that you have to get rid of. Some of these things are behavioral. Some of these things are different projects that you may have to start saving some money or call an expert in to make sure that they take care of it. It could be an electrical outlet, making sure that you get rid of an extension cord that you've been using for a very long time. Get rid of that extension cord, make sure that you have an outlet in that room, dining room, kitchen, living room, bedroom, it doesn't matter, but make sure that it's serviced by an expert. The last part of that safety stool, that seat of safety, that fourth leg is the pledge. That says that you pledge that you'll take the action. All of the information that we give you means nothing unless you take the action. The information is instructional. It'll help you to make sure that you're safe in your environment and that you're keeping your family safe. So make sure that you sit in the seat of safety, on that safety stool. Make sure that you have your smoke alarms. Make sure that you have a home escape plan. Make sure that you take care of that home fire safety checklist. And make sure that you take the pledge, which is the execution, making sure that you do it. So it's very important that you do those things. The other thing I'd like to talk about is how we got to 25 deaths, how we got to this low, this all-time low in the city of Philadelphia. It took a lot of people coming together. It took the community, the churches, it took all of the different private sector partners that came in and gave us monies and made sure that we had advertising and things like that. It took the whole community to come together in a full court press, if you will, to make sure that everyone were doing the things that they needed to do, that the education that was getting out there. So it means that community came together. We made sure that each block had a fire safety representative, those that we could get to come on board with our Philadelphia Fire Department Fire Safety Representative Program. All of those folks, they helped out. They called in. They told us about folks who were living by themselves. They were elderly. They didn't have a chance to get a smoke alarm up, or they told us that this is an area where we have young children and we want to make sure that they get smoke alarms and that they get the education that they need on how to put those alarms up, make sure that they're in, make sure that they practice a home escape plan, all of those things. So we take our hats off to our fire safety representatives as well, our block captains, all of those folks that came together and said that they would work with us to get it done. And how about our Philadelphia firefighters and our paramedics? Paramedics were going in, servicing the community, going on medical calls and saying, hey, I heard a smoke alarm beeping. Maybe they need to change it out. So as they took care of that medical emergency, they passed it on to our fire safety and education district lieutenants and captains so that they could come back out and service that household. It's just something really positive. I want to give it all to the fire department, fire prevention, our men and women that went out there and did the hard work installing 22,000 smoke alarms in the city of Philadelphia last year. They did a great job, and this is how we get to this point. So right now I'm going to talk about a very special part of our fire prevention program. We looked at the data, we did the analysis, and we came together with some of our partners that we've worked with in the past and talked to them about what we found. And right now, we're going to talk about our seniors who have died in fires. I have special guests with me tonight. I have Reverend Dr. Malcom Byrd. He's here with us. I have Ms. Lydia Hernandez Velez. She's here with us as well, and Mr. Chris Gallagher. First, I'm going to start off with Dr. Byrd. He's been employed as a public administrator in the city of Philadelphia government for 25 years. Currently, is the interim director for the mayor's office of faith-based initiatives. Very important. Dr. Byrd is an adjunct faculty member of the Eastern University School of Graduate and Professional Studies and teaches biblical, theological, and interdisciplinary courses. Dr. Byrd is a professional peer reviewer for select federal government agencies. Dr. Byrd also completed graduate studies at Antioch University and the University of Pennsylvania. Dr. Byrd is the recipient of numerous awards for his service and his leadership. I'd like to welcome Dr. Byrd.
Thank you, Commissioner.
All right, next we have Ms. Lydia Hernandez Velez. Ms. Hernandez Velez was appointed by Mayor Michael Nutter as Deputy Managing Director for Aging in November of 2010. Okay, she previously served as Executive Director of the Eastern Pennsylvania chapter of the Leukemia Lymphoma Society and Deputy Secretary of Banking for the Commonwealth of Pennsylvania. She attended Barnard College of Columbia University and Hofstra University School of Law. She served on the board of directors of Aspira Incorporated of Pennsylvania for 29 years, more than 20 of those years as chairperson, during which Aspira grew to operate 2 charter schools and a large leadership development program in 18 local high schools and local middle schools. She is married to the Honorable Angel L. Ortiz and is mom to Angel Omar Ortiz Hernandez and Lydia Pilar Ortiz Hernandez, and stepmom to Anna Ortiz, an actress. So we want to welcome you to the show.
Thank you. Glad to be here.
And we also have with us today Mr. Chris Gallagher. Chris Gallagher, he is the helpline director at the Philadelphia Corporation for Aging, and he was born and raised in Philadelphia. He has a degree from Temple University, worked at Prudential, helping AARP members, which I am a member, help those members to understand Medicare supplement plans. Also, he's managed a call center for the Healthy Choices Assisting Pennsylvania on medical assistance, and he's helping to help those folks to choose a health plan. He's also the director of the helpline at PCA currently, and for the last 12 years, he's been helping seniors in Philadelphia enroll in PCA programs, referring them to other aging programs in Philadelphia and working with the Philadelphia Health Department on the city's heat line effort in the summer, and works very close with us as well. So I want to say thank you and welcome. Welcome to the program. Going to allow all of you to just tell our listening and viewing audience exactly what you do now currently, and just give us a little overview.
Sure. Thank you so much, Commissioner, for the opportunity to partner with the Fire Department and our wonderful colleagues here from the Commission on Aging and PCA. Our office, or the Mayor's Office of Faith-Based Initiatives, is responsible for serving as the primary liaison with communities of faith here in Philadelphia on behalf of the Mayor and key administrators. And we do that to ensure that there's a continuity of constituent services available to communities of faith in ways that's comparable to other communities. We partner with those faith institutions for promoting community safety, civic engagement, public education, economic development, however we can advance the goals and priorities of the administration.
Excellent, excellent. Ms. Hernandez.
My role really is within government to really raise the issues that affect our seniors. So everything from policy development, collaborating, for example, with Freedom from Fire on a variety of different levels, and also working with the Mayor's Commission on Aging, which has 2 specific programs. One to enable seniors who want to re-engage with the workforce to be placed in subsidized positions across the nonprofit and the government sector, and also to counsel seniors when they have to make decisions about what their Medicare coverage needs to be. That's the Apprise program. But I also am the person, as you well know, in some meetings that raises his hands, well, how does this impact seniors? Nice. Let's be deliberate about it. Philadelphia's senior population is growing very quickly. There are parts of the city that are growing faster in terms of seniors. So how do we provide the information and the services that'll keep them engaged and safe?
Excellent, excellent. Chris?
Well, Philadelphia Corporation for Aging is Philadelphia's area agency on aging in Philadelphia. Every county in Pennsylvania is represented by an area agency on aging to distribute the funds from the lottery to get right to the seniors to help them. So what PCA does in the helpline in particular is to provide information to seniors and the tools that they need to really stay safe in their home, both to the seniors themselves, to their loved ones, family, friends, even neighbors, just to really come together as a community and help every senior get the information, the tools that they need to be safe and secure in their home.
Excellent, excellent. Now, one of the things that we looked at, we gathered the data on fires, injuries, deaths, the location where we have the majority of our fires each and every year. And this year, while we had a low of 25 of our citizens that perished in fires, we were also really upset to find that we still have a large amount of our seniors that pass away in fires needlessly, and of the 25, 15 were 50 and above. And of course, people will say, senior, that's not 50. But sometimes there's different disabilities and other issues around our aging. And many of our seniors who just don't have the opportunity to practice the home escape, or some that have some disabilities that would not allow them to escape early. And then sometimes we found that they didn't have a working smoke alarm, and had they had a working smoke alarm, we'd have had outcomes like we had one case of a family, husband and wife living together in West Philadelphia. They had a fire. The lady took care of her husband every day, making sure he got his medications, making sure that he was taken care of, and for the most part, he stayed upstairs. But they had working smoke alarms. They also stopped, talked about what a home escape would be based on his condition. Smoke alarm goes off, 2 o'clock in the morning. It wakes her up and it wakes him up. They have time to actually, she gets him prepared, helps him down the steps, get outside, and the firefighter said they were coming out the door and the smoke was right behind them, but there was a kitchen fire that obviously would have taken their lives or seriously injured them had they not practiced that plan and had they not had the smoke alarms. So those are the outcomes that we like to see. If there's going to be something that breaks down in your environment, we want you to be prepared. So with that high number, we stopped and we did a 10-year assessment. We stopped and we looked, and this year, last year, 60% of the deaths. In 11, 47% of the deaths. In 10, 73% of the deaths. In 09, 60% of the deaths. And I just appreciate that we've had you come and help us through those times, and each and every year when we had those types of fatalities. And now we're going to do some different things. So the first thing I'd like to ask is, Ms. Hernandez, what contributes to seniors being overrepresented in fire-related casualties in Philadelphia?
Well, there are many factors, and some of them include the fact that many of them have lived in their homes for 30, 40 years and sometimes don't realize that you have to put the batteries in the smoke alarms, or that you need one on every level. So they got one and, okay, so I have one, and they don't realize what happens in case of a fire and how we have to think about the specific steps that you outlined. And also, many seniors are in circumstances where they don't think they're hoarding, but they've created a risk for themselves, both in the creation of the fire and also getting out and being able to get out of the building or out of the home in time. And time, the smoke alarm only gives you time. The smoke alarm gives you an opportunity to react. And your point about making sure that you know what you're going to do in that emergency, so you don't have to almost think about it. Where am I going to go? How am I going to go? You can say, okay, the smoke alarm went off. The example you share, people know what to do and how to protect themselves. For many, many seniors, their budgets are very, very tight, and any cost will be a deterrent. So we have to get the word out there that this does not cost anything, that we're going to be able to reach people who may have stepped back and said, well, maybe I have one, maybe I have two, and maybe I really need a third one because there are 3 levels in my home. And for many seniors, it's really hard to think about someone else coming into their home. And so we really need to have the firemen, the fire safety staff, who is represented, has ID, and can be a trusted friend to enter the home. But for some folks, it's still not enough, and we really have to reach out and almost be affirmative with them.
Well, I know that that's one of the areas that we believe that the faith-based initiatives can really support us. So what relationship or linkage with seniors are most often visible in the communities of faith or places of worship? How could that support us as we move forward?
I think it's a safe estimate that 85–90% of seniors who are able to ambulate have a relationship with the place of worship. whether that's within the Christian, Islamic, Jewish, Buddhist traditions. They have linkages with those communities, they're invested in those communities, and have wonderful, thriving relationships there. And we believe that we can utilize those relationships that we have with seniors to assist them in feeling safe, in making wiser choices and decisions in how to increase safety within their homes. We certainly, resources is an issue. That's significant. And within communities of faith, there are lots of resources, both in terms of human resources and material resources, that can contribute to in-home safety, whether that's assisting with the installation of smoke detectors and other fire suppression equipment, helping seniors rehearse fire emergency exiting, yes. Helping to remove some of the clutter. So there are a number of things that people within communities of faith can do to support our seniors, and I believe that there's a tremendous resolve to be more readily available to our seniors.
Well, we look forward to making sure that we design programs that's going to help and that surrounds especially the faith-based community, because we need other folks knocking on the doors with us, helping us to identify and locate folks. And Chris, excuse me. Yeah, Chris, I heard you a little earlier talking about the mission of PCA. Now, how could that kind of like support and work for the fire service and for those citizens? What is the links that you see that we can put together?
Well, I definitely think, as Reverend mentioned, the people trust clergy. I think they also trust the fire department. They trust PCA. We serve over 15,000 seniors in Philadelphia currently, the most frail, elderly, people with disabilities. So building that trust, coming from that source of somebody saying, you really need to have a plan in place, an exit plan. You need to have these smoke detectors. You need to look at your electrical system and make sure you're not overloading outlets. You need to, even though you might be having some financial problems, not try to heat your home inappropriately. With space heaters, with your oven even. I mean, there's some really bad situations out there in the city that go unnoticed because there's many seniors that are really shut in, not in their community, in their home, people not checking on them. We need to check on them. We need family members, friends, neighbors checking on people, and not only checking, but initiating some changes take place. Many seniors won't ask for help. Even if somebody's coming in and checking on them, they'll say, I'm okay, everything's fine, I'm all right. Well, wait, I hear a beeping. Is that your smoke detector? No, everything's okay, don't worry, I don't want to bother you or anything. So we really have to take the initiative to say, no, you know what, I'm going to come back tomorrow with a new smoke detector. I'm going to change that up for you. Or get the fire department involved in changing the smoke detector, like you pointed out, with the new systems that they have out there, so you don't have to touch them for another 10 years. So a lot of things that we need to do to really make our most frail elderly seniors and people with disabilities more secure, safer, and sometimes it's little things. As you mentioned in your story, everything had to go right for that couple to get out of that home, but too often they don't get out of their home. So we really need to put things in place to make it a little bit easier.
Yes, absolutely. And to date, we have lost 5 of our citizens, and unfortunately, 4 of them are seniors. We lost one lady, she was 48 years old. All of the rest of those losses have been our seniors. So we're looking to redouble our efforts to get out and to partner with PCA, to partner with the Commission on Aging and all of those ministries that we can, come together, huddle, educate, make sure that we have the time to making sure that we had the time to put out there in the community to help folks out. So, that's where we're at right now. One of the things I wanted to ask you, Ms. Hernandez, is what are the services that the Mayor's Commission on Aging provides in that area?
Well, we have a lot of information that we can share with seniors who come to our offices. Everything from if they have an opportunity to get some benefits and connecting them with Benephilly, which helps seniors make sure that they get everything that they're due and all the information that they have, and sharing with seniors also information and connecting them with PCA. My idea is it doesn't matter how you touch the elder system, that you get to the right people. So we will make referrals to PCA and work collaboratively with them when we find an issue that in an individual case and also in a policy case, working with them. They're seeing things, we're seeing things. Wait, let's take a step back and maybe we can address this. And this fire safety is a perfect example of that, because we know that both our agencies touch seniors who otherwise wouldn't want to bother anybody. And that's a really important theme. We hear it constantly. I really don't want to bother anybody, but I have this problem. And so being able to bring the services to them, to bring them the information about what's available. Many seniors say, oh, it's just such a pain to apply for different benefits, the rent rebate, the property tax rebate, some other things that are available. Making it as simple and as direct as possible for them to be able to say, yeah, I called the police, I called the fire, I got something done. And being able to really say that time and time again is really important.
Well, one of the things that we see is that moving forward, we're going to have some partnerships that work. The quid pro quo in it is for not just the seniors, but also for us. We have the opportunity to help you, being eyes on the ground when we go in, put in smoke alarms, helping them to channel towards those services that you provide. So I'm going to be looking forward to working with you. It's really good to have you here so that our citizens can hear what you do, how important it is. So again, I'd like to say thank you to Reverend Dr. Byrd. I'd like to say thank you to Ms. Hernandez Velez and also to Mr. Chris Gallagher. So thank you for what your organizations do. And again, thank you for being a part of Freedom from Fire.